Good afternoon, everyone, and welcome back. Happy Friday. I just, before Dr. Morrison and Marion give their daily briefs, I would just offer some comments to begin. During these past few weeks, our province has begun a long and methodical process to reopen Prince Edward Island. This was never a process to go back to normal because nobody seems to even recall what normal was. And this nasty virus that is COVID-19 has changed everything about how we live. And the one thing we seemingly know is that those changes will continue for a long time. In this province, by following a careful health-based plan, we have done very, very well. Our island population has followed the public health directives closely as this virus has ripped through countries and states and other provinces. Prince Edward Island, through strong public health leadership, with broad public buy-in and some good luck, we've managed to largely avoid its impact. On March 13th, we didn't know then what we know now for sure. But we began making important health-based decisions to try to contain the virus in Prince Edward Island. Like other jurisdictions, we essentially locked down our province. Businesses and public institutions were closed. Islanders were contained within their homes. Hospitals were emptied. Schools were closed. Wakes and funerals were suspended. Kids couldn't see their friends. Extended families could not gather. Hockey playoffs were canceled, and so much more. Those were tough decisions that had to be made. We knew those decisions would impact thousands of islanders. In fact, we will likely need to take the months and years ahead to undertake a full analysis of the impacts that these dramatic life changes have had on Prince Edward Islanders. But we made these decisions knowing they would only be temporary. They could only be temporary. We knew that our province would need to begin to make the journey back to mark a pathway to reopen. We knew and we know that pathway wouldn't be easy. Like much of our last 10 weeks, that path is filled with unknowns, questions, and concerns. And I understand that. People are worried, people are concerned, some are afraid, and that's okay. And to be honest, I am too. Why wouldn't we be? But we cannot and must not be paralyzed by these fears. Yes, we need to be careful and cautious. We need to continue to do what we have been doing. We have to take the lessons that we have learned and use all of it to help us carefully plot the careful steps of our journey back. As with our public health response, the implementation of our recovery plan has been cautious and a health-based approach. That will continue. As we learn to live with the new realities of this time we call COVID, we must have a realistic understanding of what lies ahead. We need to take an open-minded approach to what we are dealing with now, and we will need to continue to deal with in the many months and maybe years ahead. As we embark on this process of recovery, we are learning to live with COVID, learning our way towards what we continually say will be some kind of new normal. But we also know that COVID isn't going to magically disappear. While we are opening things up slowly, we are continually watching the realities. At any time we can, and will if we have to, pull back and reinstate the restrictions in the interest of the public health. We will take this guidance from Dr. Morrison and our exceptional staff at the Chief Public Health Office, as we have all along. As we move along with recovery, we are also keeping an eye on and planning for and working toward to be ready for what could be a second wave of COVID later on this fall. Learning what we have done, learning more about the virus, and keeping islanders informed in the process. These have been and will continue to be unprecedented times. Life as we have known it has changed. Just as we had to change our attitudes and behaviors in the face of COVID, we will need to do the same as we begin the process to learn to live with COVID. We must proceed cautiously and carefully, We are and we will. The fact that we were able to make these steps is a good thing, a positive thing. For the first time in 10 weeks, we have reason to be hopeful. But we must not ease back to our pre-COVID ways. We will continue to proceed with caution and to take the directions from Dr. Morrison and the Chief Public Health Office. And in closing, I would just offer this, that Dr. Morrison and her team and the staff at Health P.E.I. under Marion Dowling and so many others have been working 18 hours a day for the last 10 weeks. They have shown us as Islanders the very best of who they are, and they have been inspirations for us, conducting themselves with decency and kindness while leading us through the most unprecedented days of the last 100 years. And while every government decision that is made should and must be subject to public scrutiny and discussion, I would hope and ask Islanders that we could do so with civility and respect. And if any Prince Edward Islander needs to know how to conduct themselves with civility and respect and decency and kindness, they need only to look to my right and Dr. Morrison. So I will close in saying, let's be understanding, let's continue to work together, let's continue to show the world why Prince Edward Island is the best place to live, to work, and to raise a family in the whole world. So with that, Dr. Morrison, I'll pass it on.
Good afternoon. Thank you, Premier. We often hear people speak about how fortunate P.E.I. is to have been minimally impacted by COVID-19. And we have been fortunate, but I believe it's been so much more than that. We did experience COVID-19 in this province. But because of the measures that have been put in place early, the planning that has gone into it, we have all together made a difference. There's been coordination and hard work. We have asked people not to travel. We've asked people to stay home, and those who did travel to self-isolate. We've had people do contact tracing of our cases. There's been screening at points of entry. We've tested hundreds of people. Operation Isolation has called thousands. We have had people who want to open up as we get out the other side of this first wave up faster, those who don't want us to open up at all. We've been trying to provide guidance and plans as we do reopen. But I'm hopeful as we go forward that we are going to be able to reconnect with loved ones in long-term care. I'm hopeful that we are going to be able to play sports again with our children. Hopeful that we will go back to church. I'm hopeful we are all going to be ready to do a bubble with Nova Scotia and New Brunswick when they are ready to do so. And that would mean we could come and go without having to self-isolate. I'm hopeful that we can see our sons, daughters, parents who may live away from Prince Edward Island. And I'm hopeful we can do so in a safe way. Today marks the first day of Phase 2 of our Renew P.E.I. Together plan. It has continued limited outdoor and indoor gatherings. Households can still gather with up to 5 individuals inside their home and up to 10 individuals when outside with your family. There's, again, limited non-contact outdoor and indoor recreational activities will continue. And today, additional businesses are reopening to the public. There are retail outlets, greenhouses and nurseries, extermination and pest control, car washes, hairdressers, barbers, pet grooming. There's more childcare providers who have reopened. There's additional non-urgent healthcare services which continue to be added, and also emergency and urgent dental care being provided at dental offices. And of course, it's important to note that these dates reflect really, businesses may not all start today, but they will open when they are feeling that that is the best decision for them. And an operational template for these businesses needs to be completed before they do open. There have been some questions about non-medical masks, and the language around non-medical masks has evolved over the pandemic. And we've talked about it a bit here before, and we've talked about that non-medical masks are not to protect yourself, but may protect others. And they are to be used when physical distancing is not possible for short periods of time. It could be used with public transport, grocery stores, and although the language around it in some provinces is going to recommend as opposed to consider, it is based on local epidemiology. But you'll see us start to use that language around recommending it for certain situations more and more, and it will become a strong recommendation if we need to as time goes on. I'm so pleased we are coming out of this first wave of the pandemic now, as spring is here and the weather is getting better. And wouldn't it be hard to feel like the beginning of the pandemic is starting right now, and we'd be having to get ourselves shut inside so much more. The retail stores are opening, people can get their hair cut, restaurants are gearing up for the next phase. We have a great deal to look forward to, and we do need to be grateful, and we need to be thankful. So please be patient. Please be kind. Thank you.
Thank you. Good afternoon, everyone. Starting Monday, more surgeries and procedures have been added to our services within Health P.E.I. And this is being done carefully with a close eye on maintaining our capacity in our facilities. Our healthcare staff have been through a huge change and effort during this pandemic so far, and I thank them, along with all Islanders. Please remember that if your treatment or procedure is being rebooked, and you will be contacted by Health P.E.I. or your specific provider. Also, please remember that if you are sick with any symptoms of COVID-19 or other illnesses, it's extremely important to make our providers aware so that infection prevention and control measures can be put in place to protect other patients and our staff. We've heard from many of you about concerns regarding restrictions on visitation, and we appreciate and share some of these concerns. We recognize that visiting is important and socialization is an important part of all of our lives. These restrictions have been very important in our response to protect Islanders, in particular in long-term care homes. Our long-term care staff and operators are extremely dedicated and committed to the health of their residents and have been doing a wonderful job during this challenging time. To be clear, in order to keep our most vulnerable populations, those in long-term care, safe as we reopen our province through the Renew P.E.I. together, we need to continue to be extremely careful. For that reason, we do not currently allow visitors except under compassionate reasons. However, we do continue to assess these protocols for long-term care homes and under our other guidelines. We understand the difficulty this situation has presented for residents, their families and friends, and our staff. I can share that we do have an approach for Health P.E.I.'s long-term care homes that would look to allow some limited designated visits in a controlled way for Islanders living in our long-term care homes. This will be reviewed and implemented in the coming weeks in partnership with the Chief Public Health Office as well as Department of Health and Wellness. Our plans will facilitate connections with designated families and partners in care for island residents while maintaining the public health requirements set out by the Chief Public Health Office to ensure the safety of residents and staff. We will provide more details on these plans next week, as well as details to further support direct family members traveling from out of province in compassionate situations and allowing them to see their loved ones. A reminder that our cough and fever clinics are ongoing. If you have any of the symptoms of COVID-19, including a new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, runny nose, sneezing, congestion, headache, muscle aches, unusual fatigue, or a sudden loss of smell or taste, please call 811 or contact your family doctor or nurse practitioner to arrange an appointment at the cough and fever clinic. If you have these respiratory symptoms and need health care assistance, these clinics are available for you 7 days a week. It will also help support our other primary care providers in family physicians and nurse practitioner offices opening up with safety in mind for the other patients that need to be seen, some in person now, as well as through virtual means. Yesterday, we saw 64 patients at our Charlottetown clinic and 23 in Summerside. Another reminder as well that as we go into a long weekend and we look forward to a new opening up and release of measures, as well as continue to prepare for what the future may hold related to COVID-19, there are urgent and emergent health care services available for you. Please call 911 or visit an emergency department if you have a health emergency, or contact your family doctor or nurse practitioner for services. Thank you, everyone, for your continued patience and kindness and support for one another as we continue to look forward to what may come and be hopeful that we will continue to have success in our response to COVID-19 here on PEI. Thank you.
Thank you very much, Marion. Thank you, Dr. Morrison. We can now turn to our friends in the media for some questions.
Julien Lecachard, Radio-Canada.
Hi everybody. Question pour vous, Dr. Morrison, en français, s'il vous plaît. Aujourd'hui, c'est la réouverture des magasins, des salons de coiffure et d'autres établissements. Et j'aimerais savoir concrètement quelles sont les règles principales que vous avez données et transmises à ces propriétaires de magasins ou salons de coiffure. Quelles sont vraiment les principales choses qu'ils doivent suivre et respecter?
Bonjour Julien. Les choses principales, de respecter la distance physique, tout ce qu'on peut faire. Et une des choses très importantes. L'autre chose est que d'avoir quelque chose en place, que les personnes qui sont malades ne rentrent pas au magasin et les personnes qui sont employées sont pas malades allant au travail. Il faut aussi avoir plus de façons de nettoyer partout où les personnes peuvent toucher, et aussi plus de choses pour laver les mains. C'est les principes comme ça, c'est vraiment c'est les mêmes principes pour tous les magasins, les mêmes sortes de principes. On sait que le virus, on apprend toujours à propos du virus, mais on sait qu'on ne peut pas avoir le virus si on ne touche pas quelque chose et met près de notre bouche ou main. On ne peut pas attraper le virus si quelqu'un ne touche pas près de nous. Alors, c'est des principes comme ça.
Docteur Morrison, pour continuer sur le même sujet concernant ces magasins, ce matin, il y avait beaucoup de lignes d'attente. Des gens sont allés pour aller se faire couper les cheveux, aller dans les magasins. Ils respectaient les distances. Mais quand vous voyez ça, docteur Morrison, est-ce que vous êtes à la fois contente de voir les insulaires sortir, aller dans les magasins, ou vous êtes aussi inquiète de voir que possiblement le virus pourrait revenir parce que les gens commencent à sortir et aller dans les magasins?
Julien, c'est vraiment en balance. J'ai l'inquiétude parce que je suis toujours un peu d'inquiétude qu'on peut transmettre le virus, mais je pense que c'est le temps d'en faire. On n'a pas eu un cas depuis plusieurs semaines vraiment et on sait c'était les cas qui étaient liés au voyage. Alors, je pense que c'est le temps d'en faire, mais d'en faire avec attention. Et on doit continuer à en faire. Alors, c'est un peu les deux.
Merci beaucoup.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you all. My question will be for Premier King, first and foremost. Your opening comments were targeting clearly some islanders who may have crossed the line in some comments that were made, I guess, over social media. I would like maybe for you to expand a little bit on what you've seen and the reason why behind your disappointment today.
Look, I understand that people are concerned and worried and afraid, as I said, and we all are. I mean, when Dr. Morrison and I meet every day, we talk about the health and safety of islanders, and it's, we take it very seriously. And nothing that we will do will ever be more important than the health and safety of islanders. And look, I'm not upset to be critiqued or scrutinized. That's my job. I'm the premier. We should be scrutinized. Democracy works when people ask questions. We don't all need to agree, and that is fine. But some of the things that have been coming in are, on a good day, Francois, I would get called things that would make the most seasoned sailor blush. I don't know how that's become an acceptable public behavior, but that seems to be the world we live in. Where I get upset is when they target individuals high caliber like Dr. Morrison, who is, certainly doesn't need me to stand up and take her apart. She's the most capable, talented, and, courageous person that I've ever been around. But, I think we can do better than that, and we should. And look, if you don't like what we're doing here as a government, lay it on me. That's fine. I can take it. But our public servants deserve a little better than that.
In hindsight, Premier, would you have made that decision to open up the borders to seasonal residents? Had you known the kind of reaction it would have created among the community?
Look, every decision that we have made so far has been a health-based decision based on the best information that we have. For 10 weeks, this is how we've been doing things. We talk every day about how we can do this, and if we make these steps that we need to make and we take these measures, what are the precautions we need to undertake to do them, and how can we begin the process back and to keep people safe and healthy. That's what we have done every day. That's what we continue to do. We are changing the way our seasonal residents come to Prince Edward Island. We're limiting a third of them who won't be able to come here this year. We're asking them to have a process, to have patience, to take time, and that's how bad our island friends and neighbors want to get back here, that they're prepared to do that. So I don't have any issue or any regret with the decision. I have great regret with how people, not that they disagree, that's fine that they disagree, but the visceral, the horrible nature to Dr. Morrison, indirectly. For me, that's fine. I can take it. I'm a politician. I'm your premier. That's what you pay me for. But, our public servants in this province are some of the greatest gifts we have here, and they deserve to be respected. And Dr. Morrison and so many others treat everybody with kindness and respect and decency, and I don't think it's too much to ask for that to be in return.
Thank you, Premier.
Laurent Rigaud, La Voix acadienne.
Good afternoon to you both. J'ai une question pour vous, Dr. Morrison, en français. Est-ce que vous avez dit tout à l'heure en anglais que la première vague de cette épidémie était en train de se terminer et qu'il fallait être prêt pour une deuxième vague cet automne? est-ce que cette deuxième vague est une certitude aujourd'hui pour vous?
Bonjour Laurent. Il n'y a jamais eu une pandémie dans l'histoire qui n'a pas eu une deuxième vague. Alors, je suis presque certaine qu'il y en aura une deuxième vague. J'espère que non, mais j'imagine qu'il y en aura. Mais on a appris tellement de choses ici dans la première vague, et puis on va être bien préparé pour une deuxième vague. Ils pensent peut-être l'automne, mais les principes qu'on met en place maintenant, la distance physique, etc., vont être importants pour toutes les vagues qui suivent la deuxième vague.
Et vous avez dit plusieurs fois en anglais qu'il fallait apprendre à vivre avec ce virus. Est-ce que finalement, ce qu'on a appris durant cette première vague, c'est que peut-être il était un petit peu moins dangereux ou violent que ce qu'on imaginait au début et qu'il faut réapprendre à vivre, comme vous le dites, avec la distance physique, et que ça va bien aller alors dans ce cas-là?
On a appris beaucoup de choses à propos du virus, mais on a appris qu'on n'a peut-être pas besoin d'aussi le nombre de ventilateurs, parce que les personnes qui sont à l'hôpital, ils sont très malades, mais ils n'ont pas toujours besoin d'un ventilateur. Mais on apprend que on n'a pas d'immunité contre le virus, alors ça peut infecter plusieurs autres personnes. On a aussi appris qu'il y a des personnes qui n'ont pas beaucoup de symptômes ou les symptômes très, très mineurs qui peuvent transmettre le virus. Alors, c'est quand même important de pratiquer la distance physique.
Merci.
Merci.
Nicole Williams, CDC.
Hello, everyone. My question is either for Dr. Morrison or Marion Dowling. I know that you've mentioned that you're working on including those in long-term care into these phase-back plans. I'm just wondering what the latest is on that and when people might be able to expect some kind of update or change.
Hi, Nicole. I'll answer this one. I think we have been making some plans and reviewing all of the concerns that have been coming in as well, and including those from our own facilities and staff. And so what we're looking at is a bit of a phased approach to some visitation, and it would be for designated visitors only, and looking at things like scheduling visits so that we can make sure there's enhanced cleaning, following all of those public health measures that would be put in place. But of course, our homes need to get prepared for these options. We need to review what we are looking at with our health P.E.I. facilities, with the private nursing home operators as well, and try and work in concert with them and the Department of Health and Wellness. So we are hoping to provide further details on what that might look like the beginning of next week, so that we can give people some time frame, and maybe we'll even have that available next week. We're certainly trying to provide it as quickly as we can, but as carefully as we can. And you know, we've been very fortunate here as well with respect to our long-term care homes. These islanders live with many difficult health conditions. They need close contact with providers in the homes that we can't limit, and we want to provide that high level of support and care. We struggle with limiting some of the family members or direct care partners who are a big part of these residents' lives within the homes, but they live in such a communal environment that adds to their risk. And they need to be there. So we're really just looking at various options of what's possible, and we believe it is possible to do, and very soon.
I know you said that you'll update us a little bit more next week, but do you have any sense of timeline that you could share with us about when it might be possible to sort of see some changes?
I believe at least within the public long-term care facilities, they will be ready next week. Sometime next week.
Oh, like ready to...
Not on Monday, but sometime next week. I think we will be ready to have some things in place in some of our homes.
Thank you so much.
You're welcome.
Louise Martin, CBC.
Hi there. Good afternoon to everyone. I'm wondering, when it comes to the seasonal residents that will be coming here, has there been any consideration given to testing everyone as they arrive on the island? I know our testing capacity is a lot higher than it's being used.
Hi, Louise. So the consideration of testing, certainly large numbers of people who are asymptomatic causes issues with some false positives, false negatives, results. And so it has been something we've talked about. It is not recommended, really, to do large groups of people who are asymptomatic. We are, as you know, doing some asymptomatic testing here of our essential workers coming back and forth. Some of the rest of the country is interested to see what our results are on that asymptomatic testing. We said we would do it for certainly a number of weeks to continue that. We know that it's more likely we can get some, the recommendation is usually to do testing with symptoms. We do testing of asymptomatic people going into long-term care. If people are arriving here, whether it's our islanders who came back in March or today, and they're going into self-isolation for 14 days, that's more important, because if someone came across the bridge today and got tested negative, it would not change the need for them to go into self-isolation, because it would measure without symptoms a point in time, but it wouldn't mean they wouldn't develop symptoms or test positive a few days later.
Thank you. Yeah, I wondered about that with the false negative aspect that you've spoken about before. And I'm wondering about the staggering of arrivals. Is there going to be a limit to the number of people you allow in per week? Will it be done in intervals? I know that the approval process, or the, putting in your documents and stuff, starts on June 1st. And yesterday you had talked about that you wouldn't expect to see people here for a number of weeks. So is there sort of a process that will happen with that, a staggering process?
Yes, there will absolutely need to be a staggering process, and I think a lot of the details are definitely not worked out. And if it takes longer to put that process in place and weeks to make sure that we get it correct, and we've talked yesterday as well about how do you balance that out from an equity point of view about having loved ones come from away, and that our family members who come for extended periods of time. There are a lot of questions about both of those groups, and so nothing has. The process is not in place at this point in time, and it will be certainly a combined effort with Justice and Public Safety and others to put that in place. But it could take a while, and I think that's okay, and because we need to protect islanders, recognizing that. Islanders do want to connect with families, and of course, if it's also takes a number of weeks, it's possible that we get a bubble with our maritime counterparts, which will allow some of that to happen, at the same time.
And Louise, I would just add, if I could, that, part of the reason we have asked our seasonal residents to embark on this process is to do just that, is to allow us to manage the process a little bit more effectively, a little bit more efficiently, all with the best interest of trying to keep our province as safe as possible. So, a lot of details, as Dr. Morrison said, to figure out, but that's exactly why we said we would begin on June 1st with that process and take the time we need to get it right.
Appreciate that. Thank you so much.
Sean McDougall, Eastern Graphic.
Good afternoon, everybody. Dr. Morrison, I had a question about summer camps this year. A lot of kids have been pre-registered for summer camps around the island, and I'm just wondering, will the camps be allowed to go forward? And if so, what are they going to look like this year?
Hi. So summer camps or day camps will go ahead. I think some of the changes in terms of what they'll look like will be in terms of numbers and also trying to maintain physical distancing as part of those camps. And the extra cleaning, just like a business. So they will look and feel different, but they will start, and I believe they can start in June as we bring that phase 3 a little bit earlier. So and we'll be talking more as we get into phase 3 about what the maximum number of people will be, even as in a gathering. And that will help some of the day camps manage the numbers of people they may have at their camps.
Okay, and will there be any sort of differences with day camps as opposed for ones that are held inside as opposed to ones that are outside?
So at this, today, if they were, if day camps were opening today, the number inside and outside is different. I think what we're trying to establish is a number that would be good for inside and outside, as long as you can maintain physical distancing in whatever space that is. So I imagine we'll end up talking a bit more about that number around sort of mass gathering of activities in the days ahead.
Okay, thank you, and have a good weekend.
Okay, thanks.
June Neepy, The Guardian.
Hi, good afternoon. Happy Friday to everyone. First question for Premier King. Just, I guess, about that media interview that New Brunswick Premier Blaine Higgs did on Wednesday about the seasonal resident announcement. He said that he was surprised by the announcement that it was coming June 1st. It seemed that he knew that there was an announcement coming, but it seemed he was taken by surprise that it was coming June 1st. So I guess my question is, why wasn't he aware that the announcement was coming before it happened?
Well, thanks for the question, Stu, and happy Friday to you. I actually talked to Premier Higgs on Tuesday before we did the announcement, and we talked about a number of things, one of them which was our desire to begin on June 1st doing what the province of Nova Scotia has been doing for the last 4.5 weeks, and that is to allow seasonal residents to make their way back from Canadian provinces to their seasonal residences with a 14-day isolation. So I'm not totally sure. I didn't see the actual interview with Premier Higgs myself. We have been in contact, and we are regularly in terms of much like Nova Scotia, we need to have individuals, if they're coming here by car, drive through New Brunswick to get to their seasonal residence. So I certainly made the call.
Okay. I guess just as a follow-up, I suppose this could be either Dr. Morrison or Ms. Dowling. I'm wondering if more diagnostic testing is now being done at the Confederation Bridge than at the cough and fever clinics. In other words, has most of the testing on P.E.I. sort of shifted to those, like the border locations, as opposed to sort of the cough and fever clinics?
Hi, Stu. No, the majority of the testing is still being done at the cough and fever, or they're really the testing clinics, because there's two aspects of those. There's actually an assessment part as well as the drive-through testing part. The testing at the bridge is really for the long-haul truckers who are coming in and out, who have very short period of time here in P.E.I, who are having difficulty getting out of any self-isolation on a regular basis, and then convenience for them, and to actually get to a clinic before they get back on the road again. And so that has been for that particular group, recognizing some of the constraints they have. So it is not a general testing clinic for everyone who has symptoms.
Okay, thanks much.
Carrie Wynn McLeod, Ocean 100.
Good afternoon to everyone, and happy Friday as well. My question is for the Premier. Mr. Premier, we have heard, a lot of disgruntled people that may not agree with the decision to bring in the seasonal cottage owners, and everybody has different avenues to express that. I have had a report that the RCMP were called to your residence today. Was that a disturbance to do with that decision? Can you confirm or deny that?
Well, I certainly... I wasn't prepared to. I think we're in obviously an emotionally charged time these last 10 weeks. I guess what happened today, Carrie Wynn, was that someone came to the house where I live, and they were upset with some decisions that we had made. I wasn't home, of course. My wife Jana was there. She was in the barn. She works, runs her business from home. She was very upset. There was a comment that was made that that led her to believe that maybe it was a threat. All of this was going on. She had called me. I couldn't take the call because I was in a meeting. She then called one of my senior staff who went through the process of calling security, and the RCMP were called. Unbeknownst, I didn't know all of this was going on. She did connect with me. She was upset. She told me what was going on. I was able to determine who it was. A neighbor of ours who lived down the road who wanted to chat. So I actually called the neighbor, and when we had a good chat. It's okay to disagree, as I say, but so it turned out fine. And perhaps if I had gotten connection with her earlier, it wouldn't have happened. But I do think that because it's such an emotionally charged time, and of course we had an incident this morning where down east, where you and I are born, of an incident with a firearm, and so it was certainly a scary couple of minutes until I was able to piece it together. But thankfully it's good. But it's just it does. Kind of pull at your heart a little bit when you're living that for a few minutes.
And how does that make you feel, Premier? That people are taking it to your personal space.
I understand the job as Premier and a politician here, and look, I think. Probably, if not one of the most, approachable premiers that we've had here, and I love that. I love people. I guess it makes me. I don't mind interacting with people. I love it. I love my constituents, and my neighbor certainly didn't have any ill intention with this. But I think your immediate thought goes to my 13-year-old opening the door and just being a good 13-year-old kid and what that could potentially be. And I know it's P.E.I. and we don't think these things happen here, but it's you know, it's tough. But I mean, look, it ended great. This is the best place in the world to live and work and to raise a family, and that's not an indication of who we are. But I hope it's, for me at least, it gives you perspective, and I hope it can give Islanders some perspective that, look, we have lots of differences of opinion and stuff, but you know, there are ways to do this and to do this civilly and have just you know, very effective and fun disagreements. But you know, I wasn't prepared for that today, to be sure.
Thank you so much for responding to that.
Rachel Collier, Eastern Graphic.
Hi, Mr. King. On a slightly different topic here, my question is, if inviting seasonal residents back to P.E.I. affects our chances at bubbling with New Brunswick this summer, would you consider reversing the decision? And I guess, is that even a concern to you at this point, that it would affect the possibility of us bubbling with New Brunswick?
I know it doesn't have any. I mean, all of the discussions that we've been having for as long as we've been having them, from Dr. Morrison's level with her public health officials in Nova Scotia and New Brunswick, it doesn't have any impact. I mean, we're looking at doing a maritime bubble, and as I say, Nova Scotia has been doing this for 4.5 weeks. And you know, the one thing that we continue to point out here, Rachel, is that our isolation measures are, you know, we lead the country. We do things here that they don't do in other jurisdictions. In fact, Premier Horgan from British Columbia has taken to following our model for their international arrivals, where we call every day to check to make sure there's isolation. So the measures that we have and the efforts that we are undertaking are tremendously more progressive and cautious than anyone else. And so look, until any such time as someone tells us differently, we're working carefully and cautiously to try to come up with a safe way to have some maritime travel in July. So the two are not related at all in my mind.
Okay. And my second question, I guess, is with child care services opening up to a number of parents and kids today, might you have any general information, maybe you've been briefed, about how many children are still on a wait list or need child care at this time?
I would need to consult in terms of a wait list. I do know, you know, I think it was 12,000, the number we talked about from K to grade 7 who wouldn't be in school now that would potentially need more child care, and we're trying to adapt to that. But in terms of the specific numbers, the best I could probably do for you today would be to get someone from the Department of Education and Early Learning to get back to you with that. But I do know that it changes every day, it evolves every day, and I know they spend a great deal of their time trying to manage this very difficult situation and try to put together a safe early learning and child care provision for Islanders who need it.
Thanks for that. Have a good weekend.
Thank you very much. And thank you also to both of you, and I hope you do have a good weekend. And thanks again for your work. And to all Islanders and members of the media, thank you, and have a good weekend.